Do doctors do this test for everybody?
No. They rarely ever do it. They do it.
Literally.
Yeah, now your rheumatologist will do it. They'll do it checking on the inflammation in their patients with rheumatoid arthritis and lupus. See, every autoimmune disease will have an elevated hs-CRP level.
Hi, I'm Mary Colbert, and welcome to Dr. Colbert's Divine Health broadcast. We are so excited to be here today because we want to bring you real answers for your health. Are you struggling with your health? Are you struggling with wellness? Do you know the will of God is that you be in health? It is His will. It's not His will for you to suffer. That is not His will. And I think it's important that you need to know that. You need to know that beyond a shadow of a doubt. Do you know that in Psalms 138, I want to read this to you. The Lord will perfect that which concerneth you. Do you know, I don't know what you're struggling with. I don't know what you're battling with, but God has an answer for everything you're going through. And you seek Him, you ask Him, you press into Him, and He will give you the answers that you need. He has never failed me, has never failed my family, and I want to give you hope today. I don't care what you're struggling with. God wants to bring you answers. And today we are doing a series called Know Your Numbers. Do you know what you don't know is what's killing you? So we want to bring you accurate knowledge, accurate, up-to-date, informative studies, proof of things that we know that works. And that's why we're doing this for you. So today, Don, this is number 6.
This is number 6 of Know Your Numbers. Number 6, Mary, is Know Your High Sensitive C-Reactive Protein, or shorten that, it's just hs-CRP number.
That's a mouthful, Don.
It is, but it's extremely important. This is a marker of inflammation. Remember, most every chronic disease is associated with inflammation, run amok. But you know that...
Well, before you go in there, you want the people to stay tuned.
Well, let me tell you why.
They want to know.
Well, there are several large, huge studies involving thousands of people have found that an elevated hs-CRP level is associated with future cardiovascular events, including heart attacks, strokes, and early cardiac death. So this could literally, in changing this down to normal, it can literally save your life from an early cardiovascular death.
So you're going to give them answers.
Yes, I'm going to how to lower it.
And you want
naturally.
You want to stay with this program because this is powerful information that you need to know.
Amen.
So go ahead, let's go.
Okay, number 1, what we have to do is realize what raises CRP levels. Do you know what raises it?
No, I have no idea.
One of the main things that raises CRP levels is belly fat. You see, belly fat is a metabolic organ in the body that churns out inflammatory mediators, including interleukins, tumor necrosis factor alpha, and C-reactive protein. It literally makes it, it's made in the fat and in the liver. And so the more belly fat you have, generally the higher your hs-CRP level is. Another is acute and chronic infections. If you have an acute infection like COVID, I've been doing this for years, hs-CRP levels. I do it on everybody. HS, high sensitive C-reactive protein, CRP.
Okay.
And what I found is I was able to diagnose many with COVID when it first came out because their CRP, I check it every 6 months, their CRP would be normal at 1 and it'd shoot up to 50, 60, 70 or higher. And I said, oh, and it'd be correlated with a COVID infection. COVID really boosted the CRP, but what happened after a week or 2 or 3, it'd usually come down to normal. Some people would have chronic activation of their CRP, and I'd have to put them on low-dose naltrexone or something to get it down. But any acute or chronic infection can raise your CRP. That means any tooth abscess, gingivitis, chronic sinus infection, chronic bronchitis, chronic prostatitis, chronic herpes, herpes simplex 1. 90% of Americans have chronic herpes simplex 1, which is fever blisters.
Yeah, fever blisters.
90%. But you know what helps correct it? A simple, inexpensive amino acid, L-lysine, 1,000 milligrams a day will prevent most chronic herpes simplex 1. If you have an acute infection, 1,000 milligrams 3 times a day for a
Now,
week or two.
now, Don, I remember when you did the blood test on me a few months
Yeah.
ago, my CRP was
Yes.
through the roof.
Yes.
I was like,
Freaking out.
oh, I was freaking out. I was like, I'm on fire. Something is going. I go to the dentist. Sure enough, I had a
An
major
abscess, tooth abscess.
abscess,
Right.
but it got picked up
Yes.
from the blood test
CRP.
that I had a major
So
abscess.
any chronic or acute infection will raise that CRP. Your body is literally mobilizing your immune system to attack. But what's supposed to happen is once you have destroyed the infection, the immune system generally settles down to normal. But if you have a chronic infection, the immune system doesn't settle down. Those same inflammatory mediators start to inflame your body, start to cause plaque in your arteries, start to literally eventually CRP not only affects your arteries, it affects your brain. It inflames the brain, causes memory loss. There's so many different things that CRP does with chronic inflammation. It causes these inflammatory mediators that are elevated can eventually affect joints in the body. With people who have elevated CRP, like obese people, they commonly have chronic joint pains because elevated CRP will inflame joints.
Sure.
So just like a fellow I saw just this past week, he came in and he had he was at 66, had pain in his knees, he had a big belly, he was morbidly obese with a BMI over 40, and he'd also had type 2 diabetes for about 10 years.
Which is inflammatory, extremely.
Exactly. I put him on the berberine, I put him on our carbacyst, we brought his sugar down to normal, which was amazing by itself. But you know what? He changed his diet a little, but he says he still eats a burrito for breakfast and with cheese on it. I said, those are inflammatory. See, certain foods raise CRP levels. We know that processed foods do it all the time. Fried foods do it all the time. Processed meats will do it. Sugars will do it. Anything that's highly processed, hydrogenated fats, excessive saturated fats. So I talk about everything
What about
that can raise it.
vaccinations? Like,
They can, sure.
can they? Do you see a because I'm very curious to know. This is a hot topic.
Yeah.
Myocarditis, which is heart disease.
Right. Myocarditis is chronic inflammation. With myocarditis, we find elevated hs-CRP levels, and that's a sign of it, smoldering infection occurring. But with, yeah,
Now, Don, I know you've got so much information to give people. It's just flowing through you. Do doctors do this test for
no,
everybody?
no.
Shocking.
They rarely ever do it. They do it.
Literally.
Yeah, now your rheumatologist will do it. They'll do it checking on the inflammation in their patients with rheumatoid arthritis and lupus. See, every autoimmune disease has pretty much everyone will have an elevated hs-CRP level. So again, autoimmune diseases that especially have high levels are rheumatoid arthritis, lupus, MS, inflammatory bowel disease such as Crohn's disease and ulcerative colitis, psoriasis. I used to have psoriasis.
Mhm.
I used to have elevated CRP back in the early 90s, but thank goodness the Lord changed my diet and I identified the foods that were fueling it, tomatoes and gluten and peppers and paprika. I was eating these inflammatory nightshades every day, almost every meal. And I craved it, and I realized the flesh is dumb. It craves the very foods that inflame it.
Now, Don, to me, I would think that this would be malpractice if a doctor doesn't check this level on everybody when they come in. No, seriously.
Insurances are trying to save money. They will only do a few tests. They'll check your cholesterol, they'll check your sugar, they will check, they don't even usually allow for vitamin D levels, which are the most important vitamins. And that's one of our major 12 things that we make sure we check. Know your numbers. Vitamin D, 25-OH-D3 level, or your vitamin D3 is really important. But these tests, I think, are critical, so critical that I check every one of my patients every 6 months, these levels.
Because to me, what this to me seems like, as checking your oil levels in your car.
Exactly right.
So just knowing what this number is would tell you if something is brewing, if
Sure.
something is going to become chronic.
Right.
It would be a phenomenal preventive measure for people. So this should be the standard
Oh, it should be.
requirement
It should.
so that people can get on top of it before it actually is a problem.
Absolutely right, Mary.
Right.
And again, it's just unfortunate it's not being done. But something else that raises C-reactive protein are food allergies and food sensitivities. And you know, the most common food allergy that we see, and most everyone eats it every day.
Gluten.
No,
Oh,
dairy.
dairy.
Very.
Dairy, which is
Cheese on the burrito.
cheese, that's it. Cheese and milk and yogurt and even butter. Butter. It contains the casein, whereas ghee doesn't. So dairy's number one. You know what number two is? Right behind it. And most people eat it almost every day.
Is it the gluten?
It's eggs. Eggs are number two. And you know what number three? Anyone for number three?
Nuts.
Yes. Which nut particularly?
Peanuts.
Peanuts. And number four are tree nuts. And number five, Mary, now you've been saying it the whole time.
Right down.
And what is it? Five is gluten.
Wow.
6 is soy. 7 is sesame seeds. When people go to Chinese, Japanese restaurants, they use sesame seed oil or they put sesame seeds.
Oh,
That's
the
number
oil.
7. It could be the sesame seed oil or the sesame seeds.
Even the seeds.
Yeah. And so again, number 8. You know what number 8 is?
Nope.
Chocolate?
Fish.
Oh, fish.
Fish, salmon, and cod, and pretty much any
Tuna.
fish. Tuna, yeah, that's a big one. You know what number 9 is after fish? Shellfish. It's a major common one. Number 10 shocked me.
Okay.
Chicken.
Oh, interesting.
Because it could be from the egg, because people will have egg and chicken, they'll cross-react. And also, most of our chicken are fed soybeans and corn. And I was shocked to learn that corn is not a common allergy, but gluten is.
Considering how genetically modified corn.
I know,
99%
exactly.
of corn.
Well,
genetically
exactly.
modified.
About over 90% of corn is genetically modified. So more people are becoming reactive to corn, but it's not the severe reactivity that we see like gluten. Gluten damages the GI tract. And that's one of the reasons why these foods create what we call increased intestinal permeability. And then that brings me to another thing. A major cause of high CRP is leaky gut or increased intestinal permeability triggered by food sensitivities, especially gluten.
So, Don, these foods that you just listed that are the most reactive that people are sensitive to, could people be sensitive to these and not even know it?
Yes, most people are, because see, the reactions they have are many times delayed hours to days after eating the food.
Days?
Yes.
Even days?
Now, with a true food allergy, that's an IgE reaction.
That's immediate.
But a delayed reaction is an IgG reaction that may occur hours to days after eating the food. So the doctors don't run the proper
That's
test.
confusing.
So it's very confusing.
Especially
So
if you're
most
monitoring
and most your allergists will miss it because they don't run the proper tests.
So there is tests people can do
I've been doing these for years. Yes.
to see if you are sensitive to it.
Exactly. We
And
can do that.
anyone with a condition that says has itis in it means they have high inflammation. Itis in itself
means
is
inflammation.
inflammation.
And that's usually high CRP.
Oh, that's good.
So pervasitis, sinusitis, arthritis.
So what are your numbers? What are your numbers? Here's your numbers. This is what you're waiting on. The key numbers that we want to achieve on hs-CRP is a level less than 1. That's ideal. Now, it's okay if your level is 1 to 3. It's okay. It's kind of like the good, acceptable, perfect will of God. Well, again, less than 1 is the perfect number.
I want perfect. I want
But if you have it 1 to 3, it's okay. It's good, acceptable. But if it's over 3, you have just signed up for heart disease. You've just signed up for a possible stroke. And you have signed up for inflammation throughout your body, memory loss. You've signed up for inflammation in your joints. It increases your risk of type 2 diabetes when you have chronic inflammation in your body. And when you eat these inflammatory foods, it's real simple. The standard American diet is highly inflammatory. You go to most any fast food restaurant, you get processed white bread, You get something fried or deep fried, like French fries, highly inflammatory to your body. You eat, condiments that many people are sensitive to. You know what the most common condiment people are sensitive to?
Ketchup.
Mustard.
Mustard. Mustard seed.
Yeah, it's very inflammatory or people are sensitive and allergic many times to mustard. But also ketchup has the tomato, which is a nightshade that inflames many people's gut.
Well,
Creates
I want to
inflammation.
learn what we can do to lower
Yes, and
inflammation.
that's
But
what.
before
Yes.
you tell us what this is, if you're watching this video, we want you to like, subscribe to our YouTube channel, or join our Facebook group at facebook.com/KetoZone. We're going to give away one free fiber zone to someone who comments. So
Good.
make sure you comment or like, and then that'll enable you to enter to win a free fiber zone. At the end of the show, we are going to give it away. Okay, Dad, tell us, what can we do to lower our CRP, our hs-CRP?
Okay, hs-CRP. Number one, the first thing we have to do is lose the belly fat. The belly fat, most every patient I see with high amount of belly fat has high CRP. They go hand in hand because that belly fat is a metabolic organ that's churning out cytokines, inflammatory mediators, and it produces CRP. So lose weight by following our keto zone diet or our beyond keto diet. That'll literally target that belly fat first. You'll burn that as preferential fuel. Also, intermittent fasting. Intermittent fasting, where you fast in like 16 hours a day and eat in an 8-hour window, is extremely beneficial in lowering CRP levels.
Break that down for us if you can. So what
Yeah.
would be an example? So if I woke up at 8 a.m.
Yeah.
Well, you eat your last meal at 6.
That's 6. Yeah, and just count, you want to count 16 hours. And so,
We eat past 6 o'clock.
So if I don't eat past 6, the
Yeah.
next time
6
I
to
can,
12 or 6 to 6, that's 12 hours, then till 10. So as you eat at 10 in the morning,
10 o'clock.
and that's 16 hours.
and that's a
And you-
16-hour fast.
That's
And you
a
eat in
day.
You eat in an 8-hour window. A lot of my patients will have for breakfast coffee with stevia or lohan or monk fruit, or they'll have green tea with stevia or monk fruit. And then they're still fasting. And let me give you another caveat. When you're fasting in the morning at around, if you get up, if you stop eating at 6 at night and then you finish at 10, and you can have your coffee or tea, go out and do your aerobic exercise. When you do that, you're in the keto zone and you're literally burning fat, and typically belly fat as the first preferential fuel, or one of the first preferential fuels your body will burn, and you'll literally melt like butter on a hot stove. It's similar to that.
And what's
It's
important
amazing.
is our fiber is illegal to
Yes,
do
you
after
can.
hours.
Yes.
And what's so good is it fills you up and helps
Great
you
filler.
sleep all night. So your blood
Yes.
sugar doesn't spike at 2 o'clock in the morning and pull you
Sure.
out of
Well,
your sleep.
here's what you do at
Yeah.
night, say at 6 o'clock or even at 7. You can have a heaping scoop of your fiber zone. I do this every night.
I like the berry.
I like the lemon lime. I let it taste like key lime pie. And so I take this with about 4 ounces of cold water, stir it up, and I just drink it. And then also at night, I take my Carb-Assist. My Carb-Assist has the most unique combination of nutrients in it, including berberine, alpha lipoic acid, chromium, and also Ceylon cinnamon. And it supports low blood sugar levels and helps to curb carb cravings. So these are simple things we do. So real quick, we have to go through these real quick. Now, for those that are morbidly obese, consider tirzepatide, which is a GLP agonist, tirzepatide, Zepbound, Mounjaro, because that really suppresses appetite and helps to burn belly fat and drops that CRP. Amazing, but that's only for you that are morbidly obese with a BMI of 40 or greater, which is called class 3 obesity. Other things you want to do is follow a healthy diet. The keto zone, the beyond keto, the healthy Mediterranean, all those are very healthy diets. And then also identify food allergies. It's those 10 key foods that many people are allergic to, and just rotate those. Don't eat them every
What do you
day.
recommend? I know it used to be.
I use a few, but my favorite now is the P88 food allergy test. And then another thing we want to do is heal the gut. I have a whole book on that, the healthy gut zone. And especially our fiber and probiotics are important for healing the gut.
I didn't think about probiotics.
And then clear up chronic infections. That's the big thing. Again, if you have a sinus infection, you have a sensitivity to dairy, and dairy causes all that mucosa to swell and block your sinus passages, and they can't drain. So what I use is I have them get a lavage system and irrigate their nose with distilled water at least once a day, flush it out, and then cut out the dairy, and then their body will literally self-correct. And chronic ear infections too.
This has been a phenomenal show. Listen, you need to make sure you stay connected to us because we have another program. We're going to go over another number. Should I tell them? I'm just going to tell you it has something to do with your brain. You're going to want to know this number. Stay connected. We'll see you on the other side. Thanks, Dad. Thanks.